not intended to be an authoritative commentary on all psych testing and cognitive testing. Think about who should get tested. There's part of me that would say everybody, because it can be really helpful for a wide range of kids. Obviously, we tend to think about it when there are specific learning issues. You know, the youngster who's not doing well at school, and they have a focal problem in one particular class, math or reading or something, or there's a big family history of learning disabilities, which we know run in families, or the kid just complains like, I can't read, something's wrong, things like that. I think we tend to think of it mostly within a school and academic context, but I would encourage us to think a little bit more broadly, because learning problems or cognitive issues can present not only in the classroom but in a lot of other domains. And sometimes the kids and families will not realize that it's related to a cognitive challenge, and so that's part of what we need to sort out. So when I see a youngster who's having a lot of what I think of as language concerns, like they don't seem to get it, they can't follow the questions, or they answer questions, but the answer they give you is kind of sideways to the question you asked, or there are lots of comments like either from parents or teachers that they don't seem to get it, or they didn't hear me say X, Y, or Z, or they only heard the first part of the question, or they never seem to follow the instructions, or don't seem to understand the instructions, and are needing to use lots of other cues to try to figure out what to do next. I'm always worrying that there's a language problem. And language problems can be part of a larger cognitive issue. So when I hear somebody having a language problem and then they need language testing, you really need to do cognitive testing, because the language testing has to be sort of contextualized within their cognitive capacity. And when I say language, I don't mean speech. I mean expressive and receptive, pragmatic use of language and things like that. And kids can often look like they can't learn if they don't have good expressive or receptive language skills, but their IQ could be okay. So really important to try to tease those things out. Kids who are having trouble socially, either they seem sort of left behind by their peers, they don't understand the rules, those kids can present as having social difficulties, but that too could be either a language-based problem or an IQ-based problem that they just can't keep up. And kids who have some mild intellectual disability can begin to lose ground with their peers as the context gets more complex interpersonally. Kids who are having major behavioral problems, there are suspensions, detentions, families being called constantly, parent has to come into class, particularly if you see it in one particular class, but really most kids would rather be naughty than dumb. So kids who are aware that they don't understand what's going on, or they can't figure out the instructions and the work, or it's too hard for them, they were much more likely to be disruptive. And what happens is if they're disruptive, they get sent out of the class, thereby reinforcing, unfortunately, their avoidance of a noxious stimulus, which is the class. And so we are unintentionally often rewarding kids for being disruptive in a class that they're struggling with because they get out of it. And so when I see, particularly in elementary school or even in kindergarten and first grade, kids who are very behaviorally disruptive, I worry a lot about learning problems and cognitive problems, because they may not have the words to say this is too hard, and it's also very humiliating when it seems to be easy for their peers. And then another time to think about it is when you may be managing a youngster's emotional and behavioral problem, but it's not getting any better. We thought we had the diagnosis, thought we had the right treatment plan, but somehow we're not making any progress. And one of the reasons, although there could be many other reasons, but one of the reasons is we may have missed something in the diagnostic formulation that has more to do with their hardwiring vulnerabilities and their cognitive and language-based difficulties. And so sometimes getting testing at that moment in time can help clarify either the diagnosis or even the way we're delivering the intervention around the right diagnosis could be modified to take into consideration the youngster's hardwired vulnerabilities. Questions about any of that, or any other kinds of kids that people have thought about?
Charlotte, any of that ring true for you?
Yeah, this is pretty good for me. Makes sense to me.
Okay. All right. Next one, Barbara.
I'd like to just add something about language issues, and that is the rather significant limitations of school-based speech-language pathologists.
Yes.
So they frequently focus, and you did say something about this, they focus on articulation, or they're not as familiar with complex language issues, and so they say everything's fine. They also may prescribe speech therapy, which is for the motor act, but even if they recognize there's a language issue, they may not be very good at translating how that language issue can affect learning back to the teacher. And whereas getting psychological testing hopefully will come, especially if it's done by a school psychologist, can result in translating that back in a useful way to the teacher. So that one's actually one of my total pet peeves, is the importance of recognizing that.
Absolutely. I totally agree.
You may need a speech-language pathologist to add their evaluation to it, because the psychologists are often limited in their language evaluation.
It goes both ways. Both
Right.
ways. And sometimes you need somebody from outside the school. So those are all good points. Okay, carry on.
Okay, so then it becomes, okay, we think we need testing. Well, then we have to decide what needs testing. So is it IQ? Is it their academic achievement? Is it, as we've said, speech and language? Is it their visual motor integration, their executive function, organizational planning capacity? Is it memory? Or is it even emotional and behavioral functioning and, personality traits? Maybe not in the very little guys, but certainly in the older teenagers, we begin to think about personality and other kinds of things that are more long-standing that we might need to begin to work with. So once we've identified a problem that we think could be tested, we have to sort through what is it we're testing for. And I'll just say I want to be really clear. We don't test for psychiatric diagnoses. Okay, there is no test that tells us the patient has diagnosis X. I see this all the time where people say, well, let's get a test for ADHD. Okay, there is no test for ADHD. There is no test for anxiety. There is no test for depression. Those are complex diagnoses that are made from the synthesis of a variety of sources of information, potentially including testing results. But there is no test for a psychiatric diagnosis.
Except, of course, learning disabilities are listed in the DSM, but other than
right, but that's not a psychiatric diagnosis in terms of an illness.
Yes, exactly.
Okay, next. All right, so we're just going to take a deep dive into the WISC, and I just picked that as the most commonly used IQ test that we see. And so most kids, if they're going to have testing, will get this as sort of the core. They may also have other additional tests administered, but most will have this. And it is normed from ages 6 to just under 17. And then there are different ones that we use for the very little guys and then for older teenagers and adults. The most recent edition, the 5th version, was in 2014. And you can see it's available in a lot of languages. And it has been normed. Each time it's translated into a new language, it is normed in that population. It can take 45 to a little over an hour to administer. You can shorten it. You can do bits and pieces. You can lengthen it to include all the little odds and ends, all of that kind of stuff. So you can tailor it, but we're just going to walk through the basic version, the sort of main package that people get. The WISC-5, compared to the WISC-4, has now 5 primary domains or indexes. We used to have 4, now we have 5. And what I wanted to do is just try to define each one of those while we're talking and give you some examples and then walk through a couple of cases at the end to sort of put this in a clinical context, because I think some of the language here gets a little jargony and it's a little hard. I know it's hard for me to hold it in my head. But basically, in order to get an index score in any of those 5 areas, so 5 are verbal comprehension, visual spatial, fluid reasoning, working memory, and processing speed. You need to have 2 subtests in each one of those to get a primary score. This other term called the full scale IQ comes from 7 out of those 10 primary subtests, okay? 2 of them are verbal comprehension, and 2 of them are fluid reasoning. And those are probably the 2 most representative, if you will, of somebody's intelligence. Okay, so let's walk through, if you go to the next slide, Barbara, we'll walk through each one of these, and I'll define some of the terminology a little bit more. So the verbal comprehension, I think most people know that each, the IQ test is made up of lots of different subtests. So the verbal comprehension domain is made up of 4 subtests. The first is similarities, which is just asking somebody how 2 words are similar. Vocabulary, where a word is provided and you have to give a definition. Then there's information, which is just some general knowledge questions, and comprehension, where you have to answer questions about a social situation or generally common concepts. Similarities and vocabulary, the ones with the asterisks, are the primary domains that contribute when you see full-scale IQ. Okay? We can get data on all of them, but when you see a full scale, it's drawing from those 2. So if you go to the next slide. Okay, so this domain really measures verbal reasoning, concept formation, fund of knowledge, and what we call crystallized intelligence. Basically, when we meet somebody and we have an interaction and we come away with our guesstimate, our gestalt about smart, not smart, very smart, not very smart, that really is in response to their verbal comprehension skill set. That's where we make our quick guesstimate of somebody's intelligence, and that's what that sort of crystallized intelligence means. It's just sort of like if you have to say it precipitated out in a domain, it would be in the verbal comprehension. This really tests the ability to understand printed words and verbal concepts, and it's knowledge that has been acquired over time through learning and experience. Kids can have a low score here if they have trouble generalizing words, like they don't really understand meaning. They can have problems with nuanced meaning or gradation of rules if they're very concrete. The caveat, though, is that just because you're low here doesn't mean you have low capacity. Because this is dependent on learning and experience, some of our kids can have low because of low exposure. Okay, nobody's talking to them, they're not reading, they're not going to school, they don't have good experience. So we see kids who have trouble with verbal comprehension because they have low IQ, low exposure to stimulation, expressive and receptive language problems, so they can't use language easily, and then reading disabilities and reading deficits where they're not going to acquire more language through the printed word. Okay? Questions about anything in that domain?
No questions from me.
Okay, I think you're the only one on the call, so we'll keep going.
All right.
Okay, so visual spatial index. This is block design. So you might vaguely have ever seen, there are red and white blocks that you have. They make me very anxious. You have to put them in a pattern. Oh, something just changed.
Oh, sorry, I was checking. I see that we have Melanie here now and Andrea too. So please pipe in Melanie and Andrea, and I will get us back.
Okay. So this is sort of, you have to create certain patterns with the blocks, and then there's some visual puzzles, and they have to pick the right piece that would finish the puzzle. If you go to the next slide. Okay, so visual spatial skills is a nonverbal task. You have to be able to see, you have to be coordinated, you have to be able to make sense of the information that's in front of you, synthesize and abstract the key information, be able to tell what's of primary importance, sort of a foreground, background, figure-ground distinction in the visual stimuli. So sometimes we see kids who are low here because they have poor graphomotor skills and they can't sort of get the pieces to go in the right place. Sometimes we see that they just don't understand how puzzle pieces might look the same but have small differences. They have trouble using visual cues to solve problems. So obviously kids who have visual spatial deficits, and you can have all kinds of brain injury that does that. But also we have kids who are not good with visually presented information as opposed to read information or orally presented information. But some kids can't use visual input very well. And sometimes they have priorities because they just see all the cues and they can't differentiate which ones to attend to at what time. Okay, next.
Can I ask a question
Sure.
about nonverbal learning disability as it shows up in the WISC? I don't know if this is something that you know about or not, but it's one of those things that I think is often missed. It's very disabling for some kids. Can you comment on that one here? Would that be relevant to this domain?
Yeah, absolutely. Yeah, because they're nonverbal, but they're still having tons of trouble. It's just not a word-based or language-based issue, those kids. That's a really good thing to add. Okay, so fluid reasoning index. This is really important one, and I think a lot of our kids struggle with this, at least the kids that I see. You probably see lots of normal kids, but I don't really see kids that are doing super well by definition as a child psychiatrist. So matrix reasoning, the kids are shown an array of pictures and one is missing in the sequence, and they have to find the picture that fits with the others. The next one is figure weights, where they look at pictures that are on a scale, and then they have to select another picture to balance that scale. Picture concepts, they have to look at a grid, basically, of pictures in rows and figure out which one in each row goes with the others. And then they have math, which is oral math questions that's timed. So this is the first one that's a timed activity, I think. So if we go to the next slide, we'll just talk through what fluid reasoning. I don't know where these words come from because to me they're not very intuitive to understand what the domain is, but so be it. So fluid reasoning measures our quantitative reasoning, our ability to classify, the understanding of a part to whole, ability to solve problems, but unlike verbal comprehension where it's based on prior acquired knowledge and experience, this is independent of previous knowledge. And that's a really key. That's why the verbal comprehension and the fluid reasoning are kind of pulled out as the big markers of things. But one requires experience. This one is totally independent of what you might have been able to do. In that sense, it's sort of the most innate, if you will. So kids who have a low score here definitely have difficulty generalizing concepts from one situation to another. They have trouble solving problems that are similar but not identical, or if the question is asked differently from how the teacher asked it in class, they'll have trouble on the test because it didn't look exactly the same, and they can't rearrange the information to be able to see that connection. They may have difficulty identifying an underlying rule that applies in different contexts and in different situations, and I think very importantly, they often have difficulty with social skills because they can't read social cues. They don't get jokes. They don't see what applied over there. Now it's funny over here. Because those things require an enormous amount of mental flexibility. And these are the kids that don't have good mental flexibility. So we see kids on the spectrum as having these problems in fluid reasoning, particularly in the social skill cueing, but also that rigidity that we see in kids who have, even high-functioning ASD kids can have some rigidity and they may have trouble generalizing, and that's a function of weak fluid reasoning. And then anytime you have a timed test, we see kids with anxiety having problems, okay, because they get stressed by that. Okay, next. Okay, so working memory has a couple of things, and this is really, I used to explain this by talking about a file cabinet. That's probably a little outdated. It shows my age. But another way to think about it is if you have your laptop open and you have multiple tabs open, the ability to scroll back and forth and access the stuff under different tabs in real time is really what working memory is about. Can you use the information? You may have it all stored beautifully, but if you can't access it, it's kind of no use. So digit span, somebody reads a sequence of numbers and you have to repeat it in that order, and then you have to sometimes repeat them backwards, depending. You have to look at pictures and put them in the right order. And then you have to, similarly with digit span, there's letters and numbers sequencing. So if we go to the next slide. So this measures the ability to sustain auditory attention, concentrate, and exert mental control, to be able to manipulate the information that you're holding, looking at those multiple tabs to find what you need to answer the question. And so that is an effortful attention activity. So we definitely see kids with ADHD and anxiety and depression having trouble with working memory. But we also see kids who may not have those things and they just have weak working memory. And these are the kids that can appear off task, forgetful. They can't follow all the instructions because they can only open one tab at a time, and then they can't find the information that may be under 3 tabs over. Okay? Go to the next one. Okay, processing speed. This really has to do with how quickly we can do things. So coding has to do with, and these have time components to them. There's rows of shapes and different lines, and you have to, depending on the age, it looks a little bit different. You have to transcribe it in a particular way, and you get extra points for being faster. And then you have another one, you have to search for certain kinds of symbols depending on what the instructions tell you to look for and how quickly can you do that. And then you have to cancel out certain, in the last one, you have to scan again and mark things that you're specifically asked to mark. And that's time limited as well. So this really is about how quickly can you do things and with what accuracy. If you go to the next. So again, as I said, this has to do with speed and accuracy. So you have to have motor coordination, good visual processing, and be able to handle the stress that comes with a time constraint. These are the kids who can't finish their homework or a test in an allotted time. And so we see kids who are anxious have trouble with this. We see kids who are depressed have trouble with this. We see kids who have poor fine motor skills, so they can't write quickly enough to do the test, even if they can think quickly enough. And these are the only kids that should get extra time, okay, because this is the only domain that will, if you give them more time, they'll get better at it. More time will not help somebody with low verbal comprehension. More time will allow somebody with low processing speed to demonstrate more success. Okay, go to the next. Okay, so I thought it would be to put it in a more clinical context rather than trying to hold all those domains in our heads, because it just begins to feel like gobbledygook, at least for me, after I hear all those words. So if you could just click once, Barbara, we'll get a case. Okay. And we can certainly talk through cases that you all may have. That would be absolutely fine. I just pulled 3 cases. So this is an early teen girl, 8th grade, doing CD work in all classes, socially awkward, and the family is very worried about her going to high school. But the school says she's passing everything. She may be getting C's, but she's passing everything. Anybody ever had a kiddo like that?
Yep.
Yeah. Okay, so if you click one more time, Barbara, this when we got testing, this is what it looked like. Now, at a glance, there's only one domain, or well, actually 2 domains that fall below, 85 to 115, right? Would be within the normal range, and those would both be borderline. So this is not a youngster that would be labeled as having an intellectual disability. And yet, she's really struggling. And we know these kids, when they transition to high school, are unbelievably vulnerable. The transition from 8th to 9th grade is going to be higher demand in work. So barely passing at this level means she's likely to struggle more academically in high school. And when we have girls who are struggling in high school academically, they, like boys or girls, they're going to look for some other domain to be successful in if it can't be in their academic life. And so we run all kinds of risks in terms of getting into other risky behaviors or finding other ways in which she can be successful. But if we look through her score, so her verbal, which is what most people are going to interact and think she is 90. That's sort of that's average, you know. The reality is many of us in our professional world if we spent a lot of time with somebody whose IQ was 90, we might not think they were that smart, but that is totally average in the world. Her visual spatial skills, a little bit lower. Her working memory, okay. Oh, where'd it go?
Sorry.
Her working memory is, almost 10 points below her verbal comprehension. Verbal comprehension leads us to think that all of her skills should be at that level. Unfortunately, her working memory, her ability to sort of deliver and manipulate information is almost 10 points lower. And then her fluid reasoning, which is the ability to navigate new problems, which if you think about what high school is, it's all figuring out what are the new rules, how do I interact with other people, how do I keep track of everything, how do I do all these things, is extremely low. And so there's a 15-point difference between her verbal comprehension, which is what everybody's going to assume she is, and her actual ability to make sense out of her environment. Her fluid reasoning is so low there that in some ways is going to be really defining to her ability to be successful with her peers and in navigating life. So even though her processing speed is fine, her verbal comprehension seems okay, it's her fluid reasoning and her ability to make sense out of new environments that is going to be the rate-limiting factor for her. Now, we can't change these numbers, right? We're not good at that. But if we know that that's hard for her, then we need to make sure that she's in a classroom going into high school that will accommodate her difficulty in making sense of things. She's going to need the rules explained to her differently than another new freshman in high school would need. Somebody's going to need to be working with her on understanding and making sense, and somebody's going to need to monitor her peer group because she will be quickly rejected by normal, in quotes from an IQ standpoint, peers in high school when she doesn't get it. She's vulnerable to being bullied, the butt of jokes, all kinds of things. And then who is left for her to be friends with is the other kids that have been rejected. And so you get into all kinds of risk factors for girls like this or boys like this in terms of their social development and social risk factors. Does that make sense?
The chances of getting accommodations, so she's not eligible for an IEP, those kids in the borderline range just drive you crazy because what you said is what she needs, but there don't seem to be many levers in the school to activate that kind of help. Right?
I would agree, and I think, the fact that this doesn't get picked up till 8th grade is also worrisome. The later it happens, the harder it is, because from a school standpoint, she's quote-unquote fine, and the school's concerned with her academic progress. But this is something that families need to understand because she's vulnerable to being exploited. And so supervision might need to be different for a youngster like this. The kind of after-school activities that they could engage her in so that she could have success might be different. So I think there's still an important component to education of families in terms of what kinds of things their youngsters are likely to be successful with and where they're going to have difficulty. And so that's, at least we can try to work with families even if the schools aren't able to provide the needed thing. Now, chances are she's likely to be unsuccessful academically in high school, which might mean she could get an IEP, which is an unfortunate way it has to happen. You have to fail before you get it. But I'd be very worried about her academically as well. So the 7-year-old boy in 2nd grade, increasingly disruptive in school with multiple suspensions, has particularly difficult time with his reading teacher, gets irritable and dysphoric. So, of course, gets sent to the guidance counselor's office, where the guidance counselor's report is that he's difficult and he refuses to talk about how he's feeling. Because I think that's how things get noticed. But this is a really common thing. We see the kids who are disruptive, so they get sent to the guidance counselor where they try to have a conversation, and the kids really struggle with that, and then that gets labeled as defiant. And so the whole thing takes on this naughty flavor way before we've understood what's happening. And I think that's really something we have to be alert to as the clinicians. So if we look at his testing results, this kid is struggling in somewhat in the opposite direction, if you will. He understands what's going on. I mean, look at his fluid reasoning. He gets the issue. He sees what's happening, but his verbal skills are 35 points lower. He cannot use language to let anybody know what's going on, how he's feeling, or whatever. And that's also why he can't be successful in reading, because his teacher assumes that he can do everything, and he can't. So basically everything on his is normal except his verbal skills. And so he gets labeled as the sullen, won't talk, as opposed to thinking he can't use language well. Let's give him other opportunities to be successful. He has strong visual skills. He can abstract well, things like that. So he may be successful at math and science where he can do and he can conceptualize and he can see, but he can't easily give an oral book report because that's going to be a real weakness for him. So a teacher needs to understand how to elicit his knowledge rather than trying to force him to do what most kids can do. And sending him to the guidance counselor to talk is probably not going to help, and it's just going to frustrate him, and he's smart enough to know that he's not able to do what other kids are doing. So the humiliation factor just gets increased when we ask him all these verbal questions. This is the kind of kid who extra time in the gym or extra time doing something would be really helpful rather than sitting and having a one-on-one conversation. Barbara, Ray, do you have other kids like this that you've worked with?
Yes. Sometimes you're not sure whether he's just laconic because he's dysphoric or something. But one of the things that would be very valuable is to have him repeat their sentence repetition tests. And if they're very simple and doesn't take long, but what you find is that instead of thinking about their spontaneous language and being confused by mood, if they will repeat brief sentences, and then you give them sentences that have more complexity to them, more grammatical structures, and what you find is that they don't repeat the morphemes, the language grammatical forms that they don't put into their spontaneous language. So they may have normal articulation, but that would be a good way to quickly differentiate those, because you'll see he'll cooperate fine with short things, short sentences, run with me, but not longer ones like they're flying fish at the zoo, something like that.
I think the other thing to keep in mind here is that this testing that Emily's got on the screen doesn't define a specific learning disability in reading, which this kid may very well have, and that requires a more specific test for reading. You can't pull it out of this test, and it's a suggestion. You look at it and you say, whoa, he probably will have trouble with reading, but then you need to get the achievement testing that shows reading trouble.
Or you might take a standard paragraph, first grade and second grade paragraph, and see how he does.
Well, that's true in the office, right? So one of the things that we do in the office is we have what's called the gray oral reading paragraphs. And if anybody wants a copy of them, just shoot me an email and I'll send them over, because having grade level paragraphs for kids to read out loud, and then you can ask them questions about it, can be really, really helpful in arming you for basically insisting on the achievement testing that might help define a specific learning disability too.
Yeah.
Okay, so this is a 15-year-old boy, 10th grade. Everybody says he's really smart, but it takes him forever to do his homework, and he doesn't usually test well because he runs out of time. He says he's stupid and is increasingly frustrated with school, and actually stopped doing his homework, saying, why bother, I'm too dumb to get it done. Anybody ever seen a kiddo like that?
Yeah. Yep.
Yeah, we see this all the time, and these are bright kids who are getting frustrated. So if we look at his testing, if you click, yeah. So everything is super high except his processing speed, which is barely normal. You know, it's the low, low end of normal. So he is so smart and can see that he can't do stuff. That frustration is unbelievably irritating and demoralizing because he's smart and everybody keeps telling him he's smart, but he can't deliver it. And that can be very, very hard. But if he had an accommodation where he got extra time, then he could demonstrate his potential in ways that he can't with the regular time allotment. But knowing that changes his experience of himself. And that, I think, is a really important component of why getting testing can be really helpful. It can be helpful for kids to be successful, but I think seeing oneself as dumb is very different than seeing oneself as, look, my brain is hardwired, I'm just slow at this. If I get extra time, I look as smart as everybody else, and probably this kid looks smarter than everybody else because he's, you know, more than a standard deviation, in some cases 2 standard deviations above norm, above average. So the testing can not only help us in understanding what's going on, but it can also help us help a kid cope with the struggles that they're having. And that, I think, is just as important a part of our role in working with these youngsters as the sort of diagnostic part of it. You know, kids need, the more they understand their own strengths and weaknesses, the more they can be good self-advocates too.
Although it's interesting that the expression, oh, he's slow, that slow is almost equated with not smart in our vocabulary, right? And so it is harder to convince kids to say, well, it takes you 1.5 or 2 times as long to get the work done, but what you produce is terrific. They say, well, you know, the world doesn't really operate like that.
Correct.
I'm actually slow, and convincing them otherwise can be difficult.
Yeah.
Having them seen by I think teachers probably are more understanding of this because they see the product, but the peer group may not be as accepting of it because they're not going to wait around for the person to, join the activity at the right speed. When a child has experienced trauma, how is it likely to show up on testing like this? Because I think that it certainly has an impact on functioning, but is there any patterns there that we should be particularly suspicious of in a trauma-exposed kid?
So I think the first issue is trauma, and trauma-exposed is such a broad term that it really depends what you mean. So trauma was in a motor vehicle crash, a month ago. No, I don't think it's going to be relevant. Trauma could be chronic, a refugee youngster who is learning a new language and is in a new environment and has had all kinds of terrible things happen. So I think we have to be really careful about using the word trauma to mean something specific and try to be as specific as we can in understanding what could happen. There are kids who have had traumas where they will have had very low stimulation and exposure, so their verbal comprehension could look low. But these are hardwired things for the most part, and so they aren't necessarily going to be impacted by the trauma directly, but I would say anxiety interferes, hypervigilance interferes, depression interferes. But trauma is not a thing in that same way. It's an experience, and how a youngster makes sense out of that experience is the important part of it, I would say. I don't know that there's any literature that says any exposure to a traumatic life event changes your IQ testing. But if you develop an anxiety disorder, if you develop a mood disorder in response to that, then those will manifest on the testing. So people who are depressed often give poor effort to things, so they give up easily. That will look like lower scores across all domains if there's no good effort. So we often talk about we don't necessarily want to test a youngster when they're in the middle of a very severe depressive episode because we know the scores will be falsely low. Okay? And again, if a kid is very anxious, anything timed is going to look poor. We have to really be mindful about what we mean when we say trauma, I would say.
The 15-year-old boy with the slow processing speed, there are increasing more rigorous requirements for getting dispensational in your SATs, accommodations that is, for extra time, and then it's do they get one time or two times the extra time, and so I wonder what other people have had in their experience about getting the requirements, the certification for extra time on standardized achievement tests, and in college also.
I would say, in my experience, the most important thing for standardized testing accommodation is good documentation of the need, and then that the homeschool is making the accommodation. If the homeschool is not making an accommodation, it will be very difficult to get testing accommodations at any kind of standardized test.
Yeah, and then as you go along, if you get what Emily just said, and then you get to MCATs or LSATs, and then they're not going to even give you a chance if the college didn't give you accommodation. So these are accumulate, and so this 15-year-old boy, it's really great to use all this good documentation to give him the best shot at all the standardized tests, and to clear his pathway even into graduate school. It could be very critical for his career.
So that actually has direct implications for the pediatricians on this call, and that is that even if you think a kid is smart, if you can see that they need extended time, it's better that it be formalized through a 504 plan rather than informal. So they may be going to a very cozy school where, of course, they give them a break, but if it's not formalized, as Emily just said, it won't translate into extended time for the tests that determine their career later. So it's not too late. It's not too late to ask for those accommodations when a kid is in high school. So just keep that in mind.
Well, it's increasingly not only the accommodations that they receive, but also the documentation from the testing. Mm-hmm. So it's really useful to get it done when they're 15 years old in 10th grade. Perfect time to do this. The SATs haven't happened yet.
How about, Emily, ADHD? It came up on a number of your slides that kids with ADHD can have trouble with these different areas of functioning on the testing that may end up giving them scores that maybe don't represent their true potential. You want to talk a little bit about that, and also what you recommend in terms of whether they go into the testing medicated or not and things like that?
Yeah, it depends what you're looking for. If we're really trying to get a kid an IEP, then I want to highlight their vulnerabilities, right? Mm-hmm. So I will say, we often will say, don't take your meds. Let us demonstrate that you need an accommodation, because sometimes they will look fine. Now, it's also important to know, do they look fine on their meds? So it really is case by case. You have to understand why you're getting testing for that particular youngster. ADHD, one of the things that we need to be thinking about is executive functioning. Kids with ADHD have poor executive functioning. IQ doesn't necessarily really, at the tests that we looked at, don't really get at executive functioning per se. They have a little bit. So for really understanding ADHD, there are probably additional tests that you would do to get at executive dysfunction around organization, planning, attention, things like that. But yeah, if you can't attend to the stimulus, you're not going to do well on the test. That's just sort of a fundamental issue. Now, what you can do when you're doing the testing is you break it up into smaller time bits. So you don't ask the kids to sit for an hour or an hour and a half. You do it in 15 to 20-minute chunks, and that's totally fine. It just means that the family usually has to come back for multiple visits to get through all the testing. So there's no set profile, I would say, for ADHD because, you're often going to see there are some kids that are very, very bright and have ADHD, and all their scores may be quote-unquote normal, but if there's a discrepancy between them, they may look functionally like they have low attention, and that like their attention could be average, but everything else is 3 standard deviations above, and so that discrepancy functionally makes them have ADHD, if you will, even though it's all normal. So some of those kids end up taking a stimulant so that their rate-limiting skill set doesn't hold them back. Other kids can have low IQ and still have ADHD. So there isn't sort of a one-to-one correspondence here between ADHD and psych testing, I would say.